The professor introduces the topic of gallstone disease, discussing its pathophysiology, risk factors, and different types of gallstones. They explain the various imaging modalities used for diagnosis and discuss radiological findings associated with gallstone disease and its complications. Next topic, radiologic management options for gallstone disease. Next topic, treatment options for complicated gallstone disease. Next topic, treatment options for cholelithiasis. Stay tuned to learn more about how we can effectively manage and treat gallstones within the common bile duct using various techniques and procedures. Professor, nuclear medicine scintigraphy, with the use of radiopharmaceuticals, provides functional and dynamic information in the assessment of gallstone disease. The professor points at a slide displaying a scintigraphy scan showing concentrated radiotracer in the gallbladder. Professor, by administering radiopharmaceutical agents, we can evaluate gallbladder emptying and the presence of abnormal bile flow. This helps us identify biliary dyskinesia, a condition characterized by abnormal gallbladder contraction. Additionally, we can assess biliary patency and detect any obstruction caused by gallstones or other biliary pathologies. Scene transitions to the title of the next topic. Professor, while gallstone disease is a common condition with characteristic imaging features, it is crucial to consider other differential diagnoses when approaching a patient with similar clinical presentations. The professor displays a list of potential differential diagnoses, including biliary sludge, porcelain gallbladder, and gallbladder carcinoma. Professor, these conditions may mimic gallstone disease on imaging, necessitating a comprehensive approach to accurately differentiate between them. Detailed analysis of imaging findings, correlation with clinical symptoms, and patient history are vital in arriving at an accurate diagnosis and guiding appropriate management. Scene transitions to the title of the next topic. Professor, gallstone pancreatitis occurs when gallstones migrate into the common bile duct and cause pancreatic inflammation. Accurate imaging evaluation is crucial for both diagnosis and determining the severity of disease. The professor shows a CT scan displaying pancreatic inflammation and gallstones within the common bile duct. Professor, imaging modalities such as CT and MRI help us visualize signs of pancreatic inflammation and identify the presence of gallstones within the common bile duct. Evaluating the extent of pancreatic involvement, the presence of necrosis, or other complications guides appropriate management strategies, including potential surgical intervention. Scene transitions to the title of the next topic. Professor, biliary obstruction can occur due to various etiologies, including gallstones. Precise imaging assessment is crucial to determine the cause, location, and extent of the obstruction. The professor points at an ultrasound image showing dilated biliary ductal system. Professor, ultrasound Connecticut, and MRI play essential roles in evaluating biliary obstruction. We carefully assess the biliary ductal system for dilatation, identify the level of obstruction, and search for any signs of associated complications such as biliary stricture or abscess formation. This information guides both diagnosis and the selection of appropriate therapeutic interventions. Scene transitions to the title of the next topic. Professor, image-guided interventions have revolutionized the management of gallstone-related complications, offering minimally invasive options for patients. The professor showcases images of interventional radiology procedures, such as gallstone removal using endoscopic retrograde cholangiopancreatography, ERCP, and percutaneous transhepatic cholangiography, PTC. Professor, procedures like ERCP and PTC permit stone extraction, stenting, and biliary drainage, all under the guidance of various imaging modalities. By utilizing fluoroscopic or ultrasound guidance, radiologists can precisely target the gallstone-related complications and provide effective treatment while minimizing surgical interventions and associated risks. Scene transitions to the title of the next topic. Professor, proper follow-up imaging plays a vital role in monitoring disease progression, assessing treatment response, and detecting potential complications related to gallstone disease. The professor displays a series of follow-up imaging studies showing the same patient over a duration of time. Professor, depending on the patient's clinical presentation and previous interventions, imaging modalities such as ultrasound, CT, or MRI may be utilized for follow-up evaluations. These studies help assess the effectiveness of treatment, the presence of recurrent stones, and evaluate for potential complications or recurrent disease. Timely and accurate follow-up imaging ensures appropriate patient management and long-term care. Scene transitions to the title of the next topic. Professor, while less invasive approaches are often preferred, surgical management remains a valuable option for patients with advanced gallstone disease or recurrent complications. The professor shows images illustrating various surgical interventions, such as laparoscopic cholecystectomy and common bile duct exploration. Professor, surgical techniques like laparoscopic cholecystectomy or open cholecystectomy aim to remove the gallbladder entirely, eliminating the possibility of gallstone recurrence. In certain cases, surgical exploration of the common bile duct may be necessary to alleviate biliary obstruction caused by stones. Radiologists need to work closely with surgeons, ensuring accurate preoperative evaluations and postoperative surveillance to optimize patient outcomes. Scene transitions to the title of the next topic. Professor, despite surgical interventions, patients may experience recurrent gallstone-related complications. Precise imaging evaluations play a crucial role in identifying and managing these recurrences. The professor showcases various imaging modalities used for identifying recurrent gallstones, such as ultrasound and CT. Professor, imaging techniques such as ultrasound and CT help identify recurrent gallstones, assess their location, and evaluate for associated complications. Detailed analysis of imaging findings and correlation with clinical symptoms ensure appropriate intervention, whether it be medical management or additional surgical procedures. Scene transitions to the title of the final topic. Professor, radiopathological correlation is vital in understanding the underlying pathophysiology of gallstone complications and improving diagnostic accuracy. The professor displays various histopathology images alongside corresponding radiographic findings on a split screen. Professor, by correlating imaging features with histopathological analysis, radiologists can refine their interpretations and develop a comprehensive understanding of the disease process. This correlation aids in accurate diagnosis, determines the severity of disease, and allows radiologists to better communicate findings with surgeons, ensuring optimal patient care. Scene transitions to the conclusion. To summarize, this video has discussed the advanced imaging methods essential for diagnosing and treating gallstone disease. As future radiologists, it is vital to stay updated on these techniques to provide accurate diagnoses and ensure effective patient care.